So now
Okay.
this is going to present tuberculosis. Go on, this.
Okay, so for today I chose tuberculosis as a disease. What is tuberculosis? Tuberculosis, or TB, as it's commonly called, is a contagious infection that usually attacks your lungs. It can spread to other parts of your body, like your brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. In the early 20th century, tuberculosis was a leading cause of death in the United States today, and today most cases are cured with antibiotics. But it takes a long time, so you have to take meds for at least 6 to 9 months. Then I have talked about the types of tuberculosis. So a TB infection doesn't mean you get sick, but there are two forms of the disease. Latent TB, where you have the germs in your body, but your immune system stops them from spreading. So that means you don't have any symptoms and you're not contagious, but the infection is still alive in your body and one day can become active. If you're high at risk for reactivation. For instance, if you have HIV, your primary infection was in the past 2 years, your chest X-ray is abnormal, or your immune system is compromised. Your doctor will treat you with antibiotics, so lower the risk for developing active TB. The second type is active TB, which means that the germs multiply and can make you sick, so you can spread the disease to others. 90% of adult cases of active tuberculosis are a form of the reactivation of a latent TB infection.
Okay.
Then I have talked about the signs and the symptoms. So there aren't any for latent TB. You'll need to get a skin or blood test to find out whether you have it or not. But there are usually signs if you have active tuberculosis disease. They include a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, and weight loss. So if you have any of these symptoms, see your doctor to get tested. Get medical help right away if you have chest pain. I have talked about tuberculosis causes and how it is spread. It's caused by a bacteria that spread through air, just like a cold or the flu. When someone who has it coughs, sneezes, or talks, laughs, or sings, tiny droplets that contain the germs are released. So if you breathe in these germs, you can get it. Tuberculosis can spread from person to person, but it isn't easy to catch. You usually have to spend a lot of time around someone who has a lot of bacilli in their lungs. You're most likely to catch it from coworkers, friends, or family members. Tuberculosis germs don't thrive on surfaces, so you can get the disease from shaking hands with someone who has it or by sharing their food or drink. Then I have the diagnosis. Yes.
Just a moment. I have a question. You have posted here a map about the distribution of tuberculosis. Do you have any information about the countries which are most infected about it? In this moment that we're talking about?
Okay,
I see that, so, for example,
firstly, we are all going through the coronavirus right now, which is also a disease that attacks the lungs and the part of where you breathe. So I have researched and I have found out that Lombardia, a part of Italy, is very open to immune diseases and lung diseases like tuberculosis, and it's very hard for them to get through this kind of diseases because their immune systems are very low because the air is very much polluted. And as I stated before, United States has always been prone to this kind of disease.
Go on with the other slide.
Okay, so I was talking about the diagnosis. There are two common tests for tuberculosis, but they don't tell you whether you have latent or active. First is the skin test, which is also known as the Mantoux tuberculin skin test. A healthcare worker injects a small amount of fluid into the skin of your lower arm. After 2 or 3 days, they'll check for swelling in your arm to determine your results. If your results are positive, you probably have been infected with tuberculosis bacteria, but the results can be false positive. So if you've gotten tuberculosis vaccine called Bacillus calmette-guerin, The test could say you have tuberculosis when you really don't. The results can also be false negative, saying that you don't have when you really do, if your infection is recent. So you might get this test more than once. The second one is the blood test. These tests are also called interferon gamma released assays of egress, measure the response when tuberculosis proteins are mixed with a small amount of your blood. If you have a positive skin or blood test, your doctor will probably give you a chest x-ray or a CT scan to look for changes in your lungs. They also might test for tuberculosis bacteria in your sputum, the mucus that comes up when you cough. These results will help diagnose latent or active. Then I have talked about the treatment and the risks. So firstly, your treatment will depend on whether you have latent or active tuberculosis. If you have latent, your doctor will probably give you medications to kill the bacteria so you don't develop active tuberculosis. And if you start to see any of the symptoms of active tuberculosis, call your doctor right away. The second one, where your doctor will treat active tuberculosis with a combination of medications. You'll take them for 6 to 12 months. Whether you have latent or active, it's important to finish taking all of your medications, even if you feel better after starting them. Lastly, the risks. You can get tuberculosis only if you come into contact with others who have it. Other things that could increase your risk include a friend, co-worker, or family member who has active tuberculosis. You live in or have traveled to an area where tuberculosis is very common, like Russia, Africa, Eastern Europe, Asia, Latin America, and the Caribbean. You're part of a group in which tuberculosis is more likely to spread, or your work or living place with someone who is. This includes homeless people, people with HIV, people in jail or prison, and people who inject drugs into their veins. You work or live in a hospital or nursing home. You're a healthcare worker for patients at high risk of tuberculosis, and if you're a smoker, sorry. Then I have also talked about the complications and the preventions. If we have time, I can also read.
Go on.
Okay, so the complications. A healthy immune system fights the tuberculosis bacteria, but if you have any of the following, you might not be able to fend off active tuberculosis. So if you have HIV or AIDS, diabetes, severe kidney disease, head and neck cancers, cancer treatments such as chemotherapy, low body weight and malnutrition, medications for organ transplants, certain drugs to treat rheumatoid arthritis, Crohn's disease, and psoriasis. Babies and young children also are at greater risk because their immune systems aren't fully formed. And the last part of my project was the prevention for tuberculosis. So to help stop the spread of tuberculosis, if you have latent tuberculosis, take all of your medications so you don't develop the active one, which is contagious. If you have active tuberculosis, you need to limit your contact with other people at work, school, or home. Cover your mouth when you laugh, sneeze, or cough, and wear a surgical mask when you're around other people during the first weeks of treatment. If you're traveling to a place where tuberculosis is very common, avoid getting close to or spending a lot of time in crowded places with people who have it. Children in countries where tuberculosis is common often get the BCG vaccine. It isn't recommended in the United States, but other vaccines are being developed and tested. That's it.
As a conclusion, what can you say about the tuberculosis disease?
As a conclusion, I can say that it's very likely it resembles a lot to coronavirus. It attacks the lungs and the immune system. And the prevention part is practically the same. So you cover your hand when you cough, you stay away. So when you are infected with the virus, you need to stay away from people who you don't want to get sick. And I know that in our country we still get the vaccine that prevents tuberculosis because we have had an experience with this kind of disease where a lot of people lost their lives because of it. So I can see that it's a very deadly disease, but as the science develops and it Like I said at the last part of my project, other vaccines are being developed and tested, so there will be more ways to prevent getting or to save people when they are infected with tuberculosis.
Okay, okay. Very good, Des.